let's just say an example here of a mast cell tumor this one's in a cat particularly. So how would you approach that just from your own rationale, clinical reasoning, and would medicinal mushrooms be something that would be indicated in a mast cell tumor? What do you think about this?
I like to use mushrooms in those cats. Again, we would start by addressing their nutrition. If we can get mushrooms into them, we've got a nice essential oil formula that can help their immune system. We'll do acupuncture with those guys to help their immune system as well. If we can get some omega fatty acids into them, we will. And the other Chinese herbal formula I like for those is blood palace as a formula. If we can get that into the cat, we'll do that as well.
Great. And again, the dosing, if you were to use some of the medicinal mushrooms, it would again be at that, obviously looking at the weight of the pet, but in that sort of 1/16 to 1/8 of a teaspoon kind of starting range.
You bet.
Yeah,
Yeah.
that's pretty
Yeah.
standard. Great. And here's another one for you, Dr. Sivula. Which type of mushroom and which amount would be helpful in chondrosarcoma, and anything in your experience to help prevent metastatic spread?
Chondrosarcomas we don't see as often as osteosarcomas in our dogs, but we do see some, unfortunately. I like the Five Defenders formula for those guys at the standard dosing. I may even overdose those guys a bit and give them the one capsule twice a day rather than, sometimes we'll use that formula, like assume the people doses for a 150-pound person and extrapolate down to the dog's weight. But actually, the Five Defenders is a formula that I really like to sometimes overdose, so to speak, and we'll use in a lot of our 60 to 90 to 100-pound dogs. I'll probably use a capsule twice a day in those guys. And so that dog with chondrosarcoma, I will, in our attempt to avoid metastasis, we will for sure start Five Defenders in them. I like CBD for those guys, and we'll use a Chinese herbal formula, an appropriate Chinese herbal formula, and I'll want to do acupuncture with them as well.
Great. Yeah, that sounds like a great starting treatment plan for sure. Yeah, so comprehensive. Okay, I have one more. 7-year-old, 75-pound female. You might know what this acronym is, but GSD, is that a
Oh, German Shepherd.
German
Yeah,
Shepherd?
German Shepherd.
I figured you'd get that. With lymphoma. So the question is, went into remission after second round of chemo, and she's had her fourth treatment. She's getting some herbal medicine right now, and she's taking half a teaspoon of turkey tail before her treatment started, and now she's added in half a teaspoon per day of cordyceps. And she's also wondering if that is enough or if adding more mushrooms into the mix, maybe she's considering the Five Defenders or adding, say, reishi or maitake. Would that be beneficial? What's your take on that?
Well, first, lymphoma is a really devastating disease, and unfortunately, it's a common one. It's a common cancer for us to see, and that 7-year-old dog is right in the ballpark of when we see them. And so my thoughts go out to the owner of that dog. And I'm glad actually that they're doing chemotherapy, because a lot of as a side note, before we get started, a lot of our clients may come and their impressions of chemotherapy for dogs, for instance, are based around experiences with people in chemotherapy. And fortunately, the side effects that are seen in people a lot of times, the nausea, the vomiting, the hair loss, and all those things, we don't see those a lot in pets. So my disclaimer would be to pet owners who may face a devastating diagnosis of some sort of cancer is, don't completely shut out the idea of chemotherapy. I think it's well worth talking to either their primary care veterinarian or a specialist, a veterinary oncologist, about chemotherapy, its risks and benefits for whatever particular type of cancer the pet is dealing with. Back to this dog with lymphoma, because lymphoma is one of the cancers in dogs that is quite responsive to chemotherapy. And so that's a conversation I may have to have with an owner that that comes in when if their dog has gotten that diagnosis and they say, I am not going to get chemotherapy, and I just, have to gently probe, why is that? And if they have just a philosophical issue with using chemotherapy, then that's fine and that's one thing. But especially if the dog's got lymphoma and the cost is bearable, again, one more thing we have to figure in with our owners is that the therapies unfortunately aren't cheap, and especially I can imagine what this owner has spent on a couple of rounds of chemotherapy, but it can be a really effective treatment for a dog with lymphoma. Now, that being said, those dogs that we see, one thing I will say is that diet is critical for these dogs. The one cancer really that we have a good handle on and how nutrition affects the tumors is lymphoma, to the extent that there's a prescription dry dog food and canned that is made for dogs with lymphoma, and that's a very low carbohydrate food. We know that those lymphoma cells, those cancer cells, love carbohydrates, and so that's one thing we need to make sure is that the diet is under control. I love Five Defenders for these guys. I think it gives us a nice balance of the various herbs, things that we deal with in our practice or in veterinary medicine, which I'm sure you deal with in your practice, is that certain things will come and go out of favor with people based on what they may see or hear or read about through friends or on the internet. And so there is turkey tail has had a great resurgence or in veterinary medicine because of its use in a study in a particular type of cancer, not lymphoma, but it's gotten some good press because there were some favorable results in its use in a university study, which is great. I think for this dog, I would feel better if it got something a little more broad spectrum like the Five Defenders. I love that formula so much. I can't see a case where, especially like this one, where it wouldn't be of great use.